Hi, welcome to Raven Medical's brief introduction to cold-related injuries. So as the name implies, cold injuries are a result of being in a cold environment at or below zero. These cold environments cause vasoconstriction, predominantly in your extremities, so your fingers, your toes, and your exposed skin, i.e. your face. This vasoconstriction will cause the tissue to run out of oxygen, and we call that ischemia. The vasoconstriction and lack of oxygen or ischemia will lead to swelling and inflammation in that damaged tissue. As well, it will also damage the blood vessels and can lead to tissue death. The assessment of cold-related injuries is based on the depth of tissue damage. Frostnip, or superficial frostbite, involves the dermis or the skin levels only. It moves freely around the subcutaneous tissue and can best be described as soft, pale, cold, numb, and it's very painful. The treatment of frostnip and superficial frostbite is fairly straightforward. It's immediate field rewarming. Using body contact or warm water, you want to rewarm the injured tissue as soon as possible. Once you've rewarmed it, you want to protect it from trauma, and if it does blister, to make sure you leave the blisters intact. The main thing to remember with superficial frostbite or frostnip is to protect it from refreezing. If the injury does refreeze, you'll have a significant increase in tissue damage. When assessing for full thickness frostbite, we're looking to evaluate to see if the skin or the dermal level is completely frozen and the freezing extends into the subcutaneous tissues. As well, joints will not be able to move if they're frozen. The skin will appear hard, pale or blue, and there is no sensation with full thickness frostbite. This photo is a good illustration of full thickness frostbite. Both of these hands are experiencing full level frostbite. The appearance is different. The key in your assessment is to evaluate if the limb or finger is completely frozen or it's hard to touch, and if there's no sensation in the frozen area. Those are the two main indications of full thickness frostbite. To treat full thickness frostbite, you want to prevent further freezing and protect the frozen tissue from movement or other damage. If medical care is within 24 hours, keep the limb frozen and transport as soon as possible to medical care. The key part of this is to prevent further use and further trauma to the frozen injured tissue. If medical care is greater than 24 hours away, you may consider field rewarming a frozen tissue if you have all the required equipment and you can prevent further freezing and movement during the evacuation. To rewarm a body part, you want to submerge it in warm water, so that's bath temperature, 37 to 39 degrees Celsius. You want to apply a sterile dressing, splint it to prevent it from moving, and to consider pain medication. I also have to remind you that workplace first aid training does not include pain medication. As soon as you field rewarmed a limb, you need to evacuate the patient to medical care as fast as possible, preventing the chance of refreezing that injury and preventing that injury from moving during the evacuation. This is an illustration of some frostbitten toes after they've been thawed in a hospital situation. So you can see by the size of the blisters that these would be fairly painful, and mobility is greatly limited once you've thawed out the frostbite. Let's move on to non-freezing cold injuries. These injuries are caused by prolonged exposure to wet and cold environments. These cold environments causes a decrease in local perfusion because of the blood vessels remain constricted for long periods of time. As well, exposure of the skin to water over hours or days will cause the skin to break down. This illustration is a rather dramatic case of what the rafting guide and river industry would call river rot. In medical terms, we'd call this trench foot. You can see obvious blanched white skin, deep cracks, and possible signs of infection. When assessing somebody for non-freezing injuries, examine the skin. If you see blocks of blotchy white skin, deep cracks, or very painful skin, as well, you can see signs of inflammation, redness in around there, or the skin will break down and you'll actually have pieces of skin coming off the feet. Those are all signs of non-freezing injuries, your key point here in assessing is look for signs of infection, red, inflamed skin, or any discharge coming from the injured tissue. Treatment for non-freezing cold injuries involves standard wound care with dry dressings. You want to keep the injured area warm and dry as much as possible. All non-freezing cold injuries should be transported to hospital for medical assessment. Some simple measures can go a long way in preventing non-freezing cold injuries. First, try and keep your feet as warm and dry as possible. If you are hiking, changing your socks frequently with generous use of foot powders goes a long way to protecting your feet. Finally, at night, ensure you have warm, dry socks to sleep in. Let's have a quick summary of cold-related injuries. Non-freezing injuries, the key is prevention, prevention, prevention. If you start to have symptoms, keep everything warm and dry. For superficial frostbite, that's described as painful, blanched white skin, but it's not deep into deep underlying tissues. Immediately rewarm them and protect them from further cold exposure. Full thickness frostbite, it's painless, it's solid feeling, and it's whiter blue in color. We protect that from further freezing and transport them to the hospital for rewarming. This wraps up our presentation on the assessment and treatment of cold-related injuries. On behalf of Raven Medical, I'd like to thank you for watching.